Um, as medical doctors, as medical doctors, we only know about oxytocin. It's causing contraction in the uterus during delivery. So, and we inject pregnant women during delivery to help them to ease the process of delivery. And also we learned from the medical school that oxytocin helps for nursing, right? Do you remember that reflex? The baby sucks on the nipples and then goes up to the brain, and then you secrete oxytocin. Oxytocin causes the contraction. That's what we learned in medical school. But recently, they find out that oxytocin can be our anti-aging drug and can be the best anti-inflammatory, antioxidant, and possibly anti-cancer agent in our body, natural thing. And that's what we're going to learn today. And I think it's good if we watch this doctor. She's a dermatologist, and she was also being surprised by the broad spectrum effect of oxytocin in our body. Especially, she's a dermatologist, so she's seeing the effect of the oxytocin on the skin and how it's helping in slowing the aging process of the skin. And so let's hear what she said. I think we can learn a lot from her, and then we can build upon what she is presenting to us of new information with the things that I collect from all this research that I have done about oxytocin. And let's go ahead and hear her what she will say. Oops. Can you hear her? Can you hear it? No?
Not yet.
Okay, so I think I need to do something here. I think when I do share, you need to do share with voice. And then you do share. And then when you click on it, it will work. Now, how about now?
Yes.
Okay, good.
Well, thank you so much for joining me today. So my first question is, can you just give a quick synopsis about your pilot clinical study regarding oxytocin and skin aging? And also, can you kind of divulge into a little bit about your findings as well?
Sure. Well, thank you for having me. Well, I was a little curious about oxytocin and how, as you said, it affects skin aging, and I wanted to delve into that a little bit. I was really happy to find that there's been some bench work showing that oxytocin is affecting the skin, and I was very surprised to find that the skin actually produces oxytocin. There was a study showing that when the skin is caressed, that it does release oxytocin. Other studies show that it does bind receptors in the skin, and then what it does is it turns off the senescence-associated secretory phenotype, SASP. So what SASP does normally is it will secrete interleukins, IL-1, IL-6, other proteases, and this creates kind of a low-level inflammatory or a little bit of a destructive picture for the skin and causes our aging. But oxytocin, when it's present, turns this off. So it has more of a protective effect for the skin, and in effect keeps it healthier and actually looking better. So what I wanted to do is see, does this translate clinically? Can we see this in people? And so I took a small group of patients, six women, and I did some photography with a Clearfield system and had everything standardized. We also used a skin age score that had been previously published, and that made it very easy to quantify and look at how well or healthy their skin is for their age. The nice thing about the skin age score is that it correlates with your age. So if you're 50, you should score about a 50. If you score 40, that means you're looking very good for your age. And vice versa, if you score a 60, then you're looking older for your age. So it was a nice tool to use. I also questioned them on their lifetime sun exposure, because as we all know, that the sun also contributes to skin aging. And they were kind enough to collect their urine for 24 hours, because that's how we had to measure the oxytocin. So when we got all this information together, I was just amazed to find that there was a correlation, a linear correlation between the level of oxytocin and the amount that their score, their SAS score, decreased. So in effect, the better they looked, they had a higher oxytocin score in spite of sun exposure. So one lady in my study, she had the highest oxytocin level, but she also had one of the highest sun lifetime exposure scores, but she looked the best for her age relatively. So it was very interesting. And then I also had a patient where her skin looked not as good for her age, and she actually reported a very low level of lifetime sun exposure, and her oxytocin level was low. So it just came together beautifully.
That's awesome to hear and very interesting. So we kind of touched on this a little bit beforehand, but what sparked this idea to conduct a study on oxytocin and skin aging?
So I've been in practice almost 20 years, and I've gotten to know a lot of my patients very well. Most of them are women, and we like to chit chat, and they tell me a little bit about their lives. And it's just struck me over the years how people who find a new love, or they're in love, they just have this glow, right? We talk about the glow, and they just look radiant. And vice versa. Unfortunately, I've had patients where maybe a spouse has died, or they have a long-term relationship that broke up, and they're just devastated, and the life just seems to disappear out of their skin. They just really look, not as vibrant. They look maybe more dull, and just their skin almost looks depleted, if you will. And so I got to thinking about this, because we all associate oxytocin as the love hormone, right? So the love hormone, and we know that it's released during intercourse. We know it's involved in birthing, but this is kind of a new idea of, is it involved in other things, and looking at it in the skin. So I was pleasantly surprised, as I mentioned earlier, to find that oxytocin is involved in the skin. And I dug a little bit deeper into that, because I thought, well, why do we have this in our body? Why would the body be reacting to a social situation, a physical situation, to make us look better, to make us look healthier? Well, I figured it has to go beyond that, and it does. There is preliminary research in every system of the body showing that oxytocin has a positive effect. For instance, in the GI tract, they are finding that oxytocin levels affect your sensation of being full. It's related to your appetite, and that lower oxytocin levels are correlated with obesity. So that's just one example. And so I find that this whole system is almost undiscovered, and that we are supposed to be more social with each other.
And on that, what was one of the most interesting things that you found out through the study?
So that is probably the most interesting, I feel. I mean, as a dermatologist, and in practice for so long, obviously I know about the skin. I was unaware of oxytocin's role in the skin, and I found that was fantastic. But this whole social interaction system, so I coined it the oxytocin social exchange system, because the more that we interact with one another on a physical level, the healthier we are. And it's almost this positive feedback loop. that we really haven't been paying attention to. And all of these years, we've known that, getting a hug from someone will make you feel good. It'll calm you down. Some people have shown that it will decrease your blood pressure temporarily or your heart rate, but I think we were unaware how much further it goes, and it really has to do with our well-being physically and mentally. We need to really take time out of these busy modern lives that we have, and we need to find time for love and endearment. And if you don't have anyone to hug, you hug a dog. I mean, that has been shown to help, or get a massage, because stroking the skin does release oxytocin. So there are so many things that we can do to make ourselves feel better and be healthier.
Absolutely. And, my one last question I have here is, what kind of impact do you think this kind of research will have on the dermatology and like skincare beauty industry?
So I'm working with a pharmaceutical company looking at a botanical that mimics that oxytocin-like effect in the skin. And to date, it has been fantastic. The results are better than I expected. I'm very excited. So I think this has been almost a missing part of our skincare routine. But on a day-to-day level, I think that dermatologists, and even just any kind of doctor, when we see our patients, we need to remind them to, get off devices and interact with their friends and family and loved ones, because it's just so important for us. And I think this past year has really shown, a lot of people have been very isolated, and it's just not healthy for us, not just mentally, but physically. We need that interaction. That's what we're here for.
Okay. So I think we learned something from her, right? Let's do this. And share again. We learned that this is kind of a new information, new discovery, and that we need to okay. This is where it's stuck. Okay. Can you see the PowerPoint? Can you hear me, guys?
Yes, we got the PowerPoint
Okay.
up.
So we learned that oxytocin is not just for birthing and for nursing. That's an old school. We learned from Dr. Nicole, I think her name, is that it's more than that. It helps in slowing the process of the aging of the skin, but also it helps in managing obesity by when the patient has oxytocin or the oxytocin is being given. It helps to increase the satiety, and that the patients will not feel hungry anymore. And that may help in managing obesity, but also oxytocin, it helps to induce lipolysis and shrinking of the fat cells directly, and it induces fatty acid oxidation. So it does help to manage those extra weight or the extra fat. So we can use it for managing, we can use it for weight loss management. But there's many other applications, and we're going to learn about all the clinical applications of oxytocin. To the point, I think oxytocin needs to be recognized as a system, and it's not just neurogenic system, but also it's peripheral, because we have receptors and we have oxytocin being released as a hormone in the blood. And as you see, the tissue is producing it, the muscles producing it, and there's receptors there. So it's a hormone, neurotransmitter. We have receptors all over the body. And some of the action of the sex hormone is mediated by oxytocin. I just learned recently that mushroom, ecstasy, works through oxytocin, to increase the oxytocin level of mushroom. And I think the therapeutic effect of mushroom may be mediated by oxytocin. And so we are learning a lot about oxytocin to the point I am kind of finding that oxytocin may be the only drug in the planet that can modulate most of the chemistry of your body, the biochemistry of the body, the hormones level, the redox, the immune balance. It can be modulated by oxytocin, and it can restore the homeostasis. So can we say the oxytocin system is like in the computer, we have something called reset factory. When your computer gets crashed, you go ahead and find the reset factory, and the whole computer goes back to the previous setting and get rid from all the crashing. We can say this is what's happening with oxytocin system. If you press on the oxytocin, in other words, if the oxytocin increase in the body, whether endogenous ones, which we can stimulate it by many different ways, stroking the skin, making love, socializing, sitting here together with the same think tank, talking to each other here, all of this can increase the oxytocin and can help us in our and healing and resetting the homeostasis and managing chronic disease and preventing it across all medical specialties. And that's what we're going to learn. We're going to learn how the oxytocin, the physiology of oxytocin, and how it's helping, for example, in stimulating the gonads, whether it is whether it is the testis or the ovary to secrete the sex hormone, androgen and estrogen, as you see it here, by releasing the hypothalamus pituitary gonad releasing hormones, right? And so luteinizing hormone and follicle stimulating hormone, all of this can be released and stimulate the secretion of the androgen and the progesterone and estrogen. Can oxytocin be a replacement for sex hormone therapy? We don't have proof for that. We need to have clinical studies to see if we could just give oxytocin would help a woman with postmenopausal. But I know it would help. So we don't need that much of large dose of androgen and estrogen and progesterone and DHEA. And that's what we need to conduct those clinical trials and find out, women's with oxytocin, how much of the sex hormone they need versus women without oxytocin. And we find out that oxytocin also would help to manage any side effects that's coming up from those sex hormone therapy. It definitely helped to increase the insulin sensitivity. It helps the secretion of insulin, so it does help to manage patient with diabetic and preventing from happening. It does help in managing inflammatory and autoimmune diseases, whether it's Th1 dominant or Th2 dominant. And we know that the Th1 dominant or Th2 dominant inflammatory or autoimmune diseases, they have a component of Th17 and both sides of the aisle. And the Th17 is part of the pathophysiology of the rheumatoid arthritis. So it's not just Th1, but also it's Th2. Th17 and allergy, for example, or systemic lupus is not just Th2 dominant, but also there's some Th17. And just inhibiting the Th17 polarization will help in managing all this inflammatory diseases, autoimmune diseases, whether it's Th1 or Th2 dominant, because you're taking care for the Th17 part of it. And as you see it here, it's inhibiting the interleukin 6 very clearly here. Well, oxytocin also helps to stimulate the thymus gland and stimulate the secretion of thymosin peptides, and it helps in enhancing the immune system against the pathogens and cancers in general. But also it helps to give you that self-tolerance, and so it stimulates the Tregs, which will help to prevent the body from attacking its own self-antigen. And Tregs also helps in managing autoimmune disease and inflammatory disease. Also, oxytocin, if you see it here, it also helps to suppress the hypothalamus pituitary adrenal axis. So we don't want to have an excess of cortisone. Why? Because too much of cortisone can lead to all the complications we know, which is diabetic, hypertension, osteoporosis. You don't want to have overactive cortisone, and also constant high cortisone can suppress the immune system and put the patient at risk of cancer infection. So oxytocin helps to dump and decrease and buffer the level of the cortisol to the physiological level that we are looking for. And so we need to have cortisone, but we need it to be in bursts. And in times we need it when we have stress, when we have inflammation, we need to have that burst of cortisone, but we don't want to have a cortisone being released constantly in a slow rate where it will suppress the immune system and break the shield of the immune system against the emergence of cancer and the surveillance, the immune surveillance of the cancer. So yes, we see that oxytocin helps to increase the growth hormones, which is very critical for cell proliferation and differentiation and renewing of the cell, and especially the stem cells in your body. You need to have some growth factor there, and I think insulin helps in maintaining that level that we need at physiological level. We see that oxytocin helps again in glucose uptake. It helps to stimulate the fatty acid oxidation. It helps to induce lipolysis. So it helps to manage. We can use it to manage weight loss, and you can use it for managing diabetic, and also it causes vasodilation as well, as you see it here, and to improve the endothelial function, right? And it helps to stimulate the nitric oxide, and all of this would help in managing metabolic syndrome in general, whether it is hypertension or diabetes or obesity. All of this can be the oxytocin can benefit and it can be used to manage metabolic syndrome, whether giving oxytocin intranasally or injecting it around the umbilical. 2 international unit, I think it's a dose to start with per day, but you can go up to 10. If you see here that oxytocin also helps to stimulate the bone formation, the osteoblast, and helps it, and so you can use it to manage osteoporosis. And there's a lot of studies and clinical studies about that. And possibly estrogen and androgen works by those 6 hormones, works the anabolic effect of estrogen and testosterone work on the bone mediated by release of oxytocin. And also we can see that the oxytocin helps in increasing the colonic motility, which is possibly this can be good for a patient with constipation, especially with irritable bowel syndrome, and they have constipated dominant of this IBS. Then we can definitely use it to increase the bowel movement and get rid from all these toxins in our body. Oxytocin also secretes this arterial natriuretic peptides, so it helps to get rid from all this excess fluid. It slows down the heart rate, so we can use this for treating myocardial infarction, angina. Also, it has analgesic effect. So if you have myocardial infarction and you're giving oxytocin, I think it just helps the pain as well. But increasing the natriuretic peptides, it does help to get rid from all this excess fluid and salt that we need in our body, and that's a good thing for a patient with heart failure to be for giving them oxytocin, right? And if you have myocardial angina and all that stuff, you want to slow down the heart rate, and so it will help also hypertension because you are getting rid from the excess of the fluid and you're slowing the heart rate like beta blocker, and you are getting rid from the excess of fluid like diuretic. So it's a natural drug to manage hypertension. Not just that, because we learned that oxytocin helps in slowing the process of the aging. Possibly it has an anti-wrinkling effect, and it helps to rejuvenate the skin. And getting rid from the excess of the fluid, and it's anti-inflammatory, antioxidant. I think if we use intranasal oxytocin, we can get rid from the baggy eyes, which most of the people above 50 are, complaining of it. It's hard to get rid from it. So possibly this will be a good option for managing baggy eyes, which is those little the swelling and edema and inflammation that's happening under the eyelid, which possibly because of the aging and all that stuff. Oxytocin helps in also manage the leaky gut syndrome and leaky brain syndrome. And how is that? Because oxytocin stimulate the tight junctions and prevent the leakage of the free radicals from the gut into the blood. And also it helps the formation of the barrier in the blood-brain barrier. You know, those blood vessels, they're tight junction. I think oxytocin helps to build it and increase that barrier to prevent the leakage of toxins from the blood into the brain. So we can use oxytocin to manage leaky gut and leaky brain syndrome. Oxytocin also helps to increase the breathing, and so this can be used for sleep apnea. Sleep apnea, they have problem, they have apnea and stomach. So this stimulates the breathing process, and because it has anti-inflammatory and antioxidant, so it will help in managing any lung diseases, whether it is fibrosis or inflammatory or infection. It helps to decrease the damage, the inflammatory damage, the ischemic damage on the lung when we have respiratory diseases. So I can use it for lung diseases. We already know that oxytocin it's good for we use it for delivery of the the baby. It helps to induce contraction of the uterus. So we already know that it's involved in the process of uh, of nursing, and that's why in the farmers, they use oxytocin to increase the amount of the milk produced from the cows, right? They're actually injecting oxytocin into the cows. Does that mean there's some oxytocin in the milk cow? That's possible, but I don't see any harm in having oxytocin in the milk. What else we can see here? We see that oxytocin helps to increase the acuity of the vision, helps to increase the acuity of the smell, taste, hearing. So you can improve all this five senses that you have, maybe the six senses, but the five senses for sure. So you can hear better, you can smell better with increased oxytocin. In addition to that, the oxytocin helps to create that bonding relationship between the mother and the child, and between the person and the owner, or the dog owner and the dog. It creates that bonding, to the point they're injecting dogs with oxytocin to increase that bonding and between the owner and the dog. It also helps to increase the monogamy relationship, and it decreases the cheating process as well. They inject guys, and they find out they don't have any more interest in porn and all that stuff. They're more into monogamy, and I think this will be a good solution for many managing the number of divorce that we have, and lack of interest with your spouse. Maybe with time you get bored and you want to look for difference. If you give them oxytocin, that may keep them together and increase that bonding and increase that monogamy, and decrease the divorce rate and all the consequence of the divorce rate, which the children, they get lost in in between all these problems. Oxytocin helps to increase the social recognition, face recognition, helps in our behavior. Definitely, it helps to increase the focus. So we can use it for attention deficiency syndrome, and you can use it for people with antisocial behavior, because it does help to increase that passion. It helps with depression, so you can use it for managing hedonia and anxiety, and it does have anorexic effect, so it does help to decrease the appetite, and so we can use it for weight loss, better than any other drugs. I mean, there's drugs called the semaglutide out there, but the mechanism of oxytocin and semaglutide are the same. They are the same pathway. They work on glucagon peptide, same signaling, and some of research, they say it's not good even to use them together, because may cancel each other, although some researchers, they say they have synergetic effect, but the semaglutide is a big pharma product, and there's some study it says it can lead to pancreatic cancer, some studies. And so I prefer oxytocin, better way of managing weight loss. Even if it's slower than the semaglutide, it's still more safer. If give me a choice between oxytocin and semaglutide, I would use oxytocin.
Hey, Doc. Hey, Doc.
Yeah, can you hear me?
Yeah, I didn't want to interrupt you, but you've got a big gray box that's blocking some of your slide. I don't know if you could see that.
No. Can you see it now?
Yeah, it's still there. It's blocking, it's underneath the hearing and the insulin. It's blocking some of the words.
Okay, but I don't see it. So even if I flip it, it's still there?
Yes.
Okay. So what I would do, I need to go ahead and end and then share it again. Can you see it now?
No, we're back to the gallery view.
Okay, now can you see it?
You're starting the screen sharing, and yeah, you still got it's a bigger gray block now. Now it's
Can you see?
little smaller.
Okay. Now what about now?
Yeah, it's still there.
Yeah. I don't know how to control this. It's not. Is it affecting what about now?
Yeah, it's still there. I don't know what's going on.
It's changing shapes now. Yeah.
Okay.
I think it's probably censorship by the government,
Yeah.
They're like
You think
blotting
so?
out. Nah, they would target other stuff.
I don't think they. Okay. I think.
No, it's something with your connection.
What about now?
Yeah, it's still there.
I noticed it the other day, Dr. Halasa. I think it might be something with your computer because I did see it on a presentation
Okay, what
you
about
gave the
now?
other day.
Yeah, if you look at my screen from the iPad, you can see it.
You still see it even if I remove all this thing.
Yeah, I think it has something to do with memory. I don't know. It's still doable.
Okay. So let's stop sharing and try it again.
That did help.
What about now? Did it help?
Now
It's not there now.
Now we got your full screen.
Yeah, but now we've got your full screen of your laptop. Yeah.
Okay. And
So
we can go.
Now bring Zoom back up. Yep, like expand your Zoom back up.
Now, what about now?
Now it's gone.
Yep.
Boom.
Okay. Okay, Dr. Mike, you there?
Yep.
Okay, that's good. Well, now now it's very clear that oxytocin it's like a reset, homeostatic reset button for the humans and the animals, right? So if you increase it, see how all this change is going to happen. And we can summarize the change into, or we can categorize them into three things. It restored the metabolism, and I'm talking about the hormones and all those factors that we talked about, all those parameters, physiological parameters, restore them, right? So it restored the metabolism. It restored the immune balance, right? As you see, it's balancing the immune system. It's inhibiting the extra hyperimmune response. It's suppressing the hyperimmune response those excessive inflammation that we don't need. It's causing more destruction in our body, especially that mediated by interleukin 6 and Th17 and neutrophilia. So it's balancing the immune system. It's restoring the metabolism, and we saw that it's restoring the glucose, the hormones, right? It enhanced if you improve the leaky gut and you improve all this, you can buffer the redox by doing that because you're preventing the leakage of the free radicals, and also it stimulates the expression of antioxidant enzymes and stimulate anti-inflammatory cytokines. So it does buffer the redox as well, and it inhibits the NOx enzyme. It stimulates the parasympathetic and we know the parasympathetic, it's an anti-inflammatory arm of autonomic nervous system, and it inhibits the sympathetic system, which is the inflammatory arm. So it just helps to balance the whole physiological process of your body, the metabolism, the redox, the immune. And that's what we do when we manage chronic diseases. As chronic disease prevention management specialists, we're different from the mainstream medicine. Mainstream medicine, like a neurologist, when he tried to manage dementia, he would say, okay, so what's the problem with dementia? We have less amount of acetylcholine, and that is the problem, okay? And how we can manage that? Increase the bioavailability of oxytocin. So that's the metabolic, narrow-minded, tunnel vision of the neurologist. And he will just prescribe you a drug that will increase acetylcholine. So he's fixing the metabolic, part of the metabolic process, but he is not fixing what caused the decrease in acetylcholine. And what's caused the decrease is degeneration of the neurons. Is the neurologist thinks about how to slow the degeneration of the neuron? No. And that's where we, as chronic disease prevention management doctors, we say, in addition to increasing acetylcholine bioavailability by using a big pharma drug that inhibits acetylcholine esterase, I think we need to also think of how we can slow the degeneration of the neurons. And the mainstream medicine, they say there is no way to slow the degeneration of the neurons. They don't have that kind of edge. For us, we say, yes, we can. What causes degeneration? Well, excess of free radicals and inflammation. We will see that dementia is not just decrease in acetylcholine bioavailability, but also it's because of there's inflammatory process. There's imbalance of the immune system. There's two active Th1 and Th17 that needs to be balanced, needs to be shifted to Th2, and we need to increase the Treg in order to decrease the inflammatory factor or the pathological factor of dementia. That the mainstream medicine, they don't even consider that, right? We think that this is the case. So we give drugs that helps to balance the immune system. We give, for example, thymosin beta. We can give oxytocin. Oxytocin can help that as a peptide to balance the immune system. We give erythropoietin peptide. And also we think about, or there are also too much of free radicals as well. And reactive oxygen species, it's the reason why it's inducing apoptosis and possibly some leakage of if there's any leaky gut syndrome, those free radical generators that's being leaked from the gut into the blood, it may aggravate and speed the process of degeneration because it will add more free radicals there and add more inflammation irritation. So as a chronic disease prevention management doctor, we say, okay, we need to fix the leaky gut, right? The neurologists, they don't even consider that. They say, oh, leaky gut is gastroenterology. Go to gastroenterology, it's not my business. And then we think, oh, okay, the patient has diabetic, and that's meaning he has too much of sugar in his blood, and sugar get oxidized in the blood and become glycans, and they become free radical generator, and that may also speed the process of degeneration of the neurons. And as a CDPM, yeah, we need to fix that. Hypertension is causing all this pressure on the blood vessels, causing more endothelial dysfunction. It's causing atherosclerosis. It's generating all this micro ischemia and all that stuff. So we think now we need to manage the hypertension. We need to slow. The neurologist will go to your family physician to fix your blood pressure. But the high blood pressure is speeding the process of dementia. And another thing is that we think, oh, well, sympathetic is too much of sympathetic is inflammatory, parasympathetic is anti-inflammatory. So those patients with dementia, they may have stress and they may have too much of excess of sympathetic activities. So we need to work on that. And oxytocin can balance that, right? It helps the sympathetic, stimulate the parasympathetic, and you can decrease the inflammation and the process of the degeneration and help the patient with dementia, to the point that some companies, they are having some electrical device that you put in your neck there and stimulate the vagus nerve, and this may help in slowing the process of degeneration because it buffers the redox. And so we look at all the free radical, we screen all the free radical generators in the body, not just, and we look at if there's any vitamin D deficiency that will decrease the expression of antioxidant enzyme. And so you need to fix that and see if there's any other vitamins, any other malabsorptions needs to be addressed, because we need to restore the whole parameter. 6 hormones, for example, needs to be fixed as well. Because if you have low androgen, low estrogen, you will have endothelial dysfunction, and also you have low expression of antioxidant enzyme, and you have too much of free radical production as well. And so we need to fix that, and it will improve the endothelial function. And we know that part of dementia is some sort of, there's vascular dementia, where you have some decrease in or kind of micro ischemia, vascular abnormality, which we call the ischemic effect, that may speed the process of the dementia. We call them vascular dementia, right? And all of this needs to be addressed. Neurologists, they will not do that. We, as chronic disease prevention management, we need to consider all of this, and we start managing it. So that's the reason the outcome that's coming up from Dr. William Bill with his patients is better than a specialist, because we are addressing all the different angles to manage chronic diseases that affect that organ, and cannot be managed by just, tunnel vision and focusing on just fixing the acetylcholine bioavailability. It has to be managed as a whole, and look at the root cause and find out what caused the decrease of acetylcholine, which is degeneration, and how we can slow the process of degeneration by balancing the immune system, by balancing the redox, and yes, by restoring the metabolism, but not just acetylcholine, but all other metabolic process needs to be restored back to normal. And oxytocin is the drug of the choice, can really restore the whole homeostasis and slow the degeneration process of all the organs, not just for dementia, but all the organs in your body, by affecting or by restoring the metabolism, the hormones, restoring the physiology of the immune system, the balance of the immune system, and the redox status. This is just another illustration that shows how the clinical application of oxytocin in managing chronic diseases, whether it is inflammation or ulcers or all this. We already explained it in the previous slide. So we said that we are proposing a new system, a new biological system we call oxytocinic system. If you Google oxytocinic, you will not find it. So something we invented as a group of CDPM and your group as the Academy of Osteopathic, Integrative Osteopathic Society. We come up with respecting the oxytocin as a system, not just a drug that helps in delivery and helps in nursing, but it's a big system that can restore the homeostasis and can be used to manage all chronic disease across all medical specialties, including it helps to prevent cancer and possibly use it for cancer management as well. So we are respecting oxytocin, and we are saying that it's a complete biological system that is not being discovered, needs to be discovered, and needs to be we need to investigate more about it. We need to conduct more clinical trials about it and see how we can benefit from the use of oxytocin in managing, as I said, chronic disease across all medical specialties. I'm talking about degenerative disease, autoimmune disease, inflammatory disease, pain, metabolic, aging process, dry eye, tinnitus, name it. There's many conditions, stroke, cardiovascular diseases, weight loss, hypertension, diabetes, right? All of this, we can use oxytocin as an adjunct or the main treatment for all these conditions. And as I said, it's a system that has receptors, not just in the nervous system, in the brain, but also it's all over. It's peripheral and central. So we have receptors in the muscles, in the bones, and the skin, and it's produced there as well, peripherally, not just in the posterior pituitary. Before we think it's all produced in the posterior. No, it's produced all over the body as a parahormone or hormone or neurotransmitters. And also we have receptors in the brain, in the central nervous system, and also in the periphery and in the tissues. And so collectively we can call this a system similar to cannabinoid and endocannabinoid system, right? I just find out that mushroom therapy ecstasy works by increasing oxytocin, and sex hormone also can work. Some of their mechanism works by increasing the oxytocin. So there's a lot of mechanism of actions of those drugs are mediated by increasing the oxytocin. And oxytocin increases the nitric oxide, by the way, so and increasing the cyclic GMP. That's how it mediates this action. But so we see here how we stimulate oxytocin in the body. You know, before when in medical school, we only know about oxytocin if the baby sucks on the nipple, it goes that reflex, right? Which sends a signal to the brain and then secretes the hypothalamus. The hypothalamus will secrete the posterior through the pituitary part of the pituitary gland. The posterior pituitary portion of the pituitary gland will secrete oxytocin into the blood, and then it goes into the breast and stimulate the contraction of the breast, but also stimulate the contraction of the uterus at the same time, and gives that tickling, passionate feeling. That's why women, they like to hear the voice of the kid. It just increased their dopamine and oxytocin, because the happy molecules, the serotonin and dopamine will increase when they hear the voice of the kid, and they feel attracted to it because anything increases dopamine and makes them happy as well. And so they like to see the baby face and all that stuff. And so that's what we learned, but it's not just that. Actually, oxytocin involved in our relationship with our spouse, that when we see the attraction, the sexual attraction, all that stuff, oxytocin increase, and that gives you that attraction feeling, the bonding feeling, the orgasm that we're looking for, the sexual sensation will enhance by the oxytocin. So it's not just for the babies, but also it's for the adult and for the sexual relationship and the bonding, and making love definitely increase the oxytocin. Stroking the skin can increase. So massage, when you go to the massage, you feel all relaxed and sleepy and happy, and dopamine is increased, and you want to do more of massage. I myself, when my wife massaged me, I fall asleep, because it definitely helped to block the pain. Also, if you have back pain and she massage it, oxytocin is a very powerful analgesic, because it increases the dopamine, it increases the endorphins in your brain, it stimulates the serotonin, so it gives you that happiness. And what drives us, what moves us to do anything, it's the dopamine. And anything that increases dopamine on oxytocin, of course, the oxytocin increases the dopamine, it makes us to move to it and do it, right? And even if you have two things that increase the dopamine, which one are you going to move? You're going to move to the direction where it goes the highest dopamine, right? And so our instant thoughts and drive and motion and movement, it's decisions. It's all based on the release of oxytocin and the increase of the dopamine, because the dopamine is the rewarding, and that gives you the happiness and excitement of doing the thing that you want to do. And so what stimulates the oxytocin? Again, stroking the skin, massaging, probiotics, possibly, yes. What else? Abdominal breathing, that may help to increase the vagus nerve, and vagus nerve stimulate oxytocin. Oxytocin stimulate the vagus nerve. Nursing, yes, as you see, sucking the nipples. Exercising, smelling perfume, reading and enjoying what you're reading, increasing the oxytocin. Meditation, cuddling, touch, nice tasty food can increase oxytocin. Nice music, right? That's why Dr. Mike Beamer, he likes to, he's part of the band, a music band, and even he changed all the schedule from Friday to Thursday to Monday, just because he wants to attend the music, because he's a good guitar player, by the way. So maybe he's going to bring his guitar when we meet at A4M. so he can entertain us with his voice and with his guitar, right, Dr. Mike Beamer? And also, visual things, especially the beauty of the nature or the beauty of your wife or your spouse or girlfriend. All of this helps to stimulate oxytocin. So it's not just sucking the nipples anymore. Um, and if you want to go more deeper into chemistry and you want to see how oxytocin, chemistry-wise, helps in managing chronic diseases and give you that helps to manage metabolic syndrome specifically, as we see it here. We can see that oxytocin stimulate the AMPK. The AMPK. It's a system of proteins, of enzymes, and signaling that will definitely stimulate what we call the mitochondrial uncoupling. And when you are inducing mitochondrial uncoupling, what's that mean, mitochondrial uncoupling? We know the mitochondria, the electron transport chain is coupled with production of ATP, right? Okay, and so we see the electrons that are moving around the electron transport chain, and then it will be picked up by the oxygen at the end. And then as the electron passes the electron transport chain, the hydrogen will be pumped out. And then you transform this energy of electricity into hydrogen gradients, right? And then the hydrogen gradients will start moving inside the mitochondrial matrix through the ATP synthase channel, and that will convert the hydrogen gradients into energy of the ATP, right? And that's the coupling, right? And so basically, the hydrogen goes in, and then the hydrogen will react with the reactive oxygen species. So the mitochondria is a source of ATP, and it's a source of free radicals. And in order to, of course, you have all this oxygen is going to pick up those electrons inside the mitochondrial matrix, and they become free radicals. And they're going to wait for the hydrogen that's going to be pumped in, or it's going to be going along with their gradients and drive the ATP production for the ATP synthase to react with this superoxide and free radicals to become water. And so some of those free radicals will not be waiting for those hydrogens to come in and kind of neutralize those superoxide radicals. So they will be released out, and the mitochondria produce a burst of free radicals, which is very essential. But too much of free radicals for mitochondria is not good. It can cause all this irritation, inflammation. And so if I uncouple this process of electron transport chain ATP by having proton channels that will allow protons to influx in, and also that we need to have an illustration for that. Now, next time when I have a presentation, I'll show it. This will help to neutralize more of those free radicals and decrease the free radicals production from the mitochondria. And as you see here, the RS will be reduced by the mitochondrial coupling. And doing that, you can manage oxidative cell damage. So what signal and increase the expression of those proteins that will cause the uncoupling of mitochondria and decrease the free radical production is the AMPK signaling, okay? Which is adenosine monophosphate kinase. It's just a enzyme or a signaling molecule that, or protein enzyme that stimulate the adding of phosphate group to the enzymes, and that's how you turn them on. You turn on those cascade of enzymes, and that will possibly increase the expression and activity of those uncoupling proteins, and eventually it will lead to decrease the ROS production from the mitochondria and decrease oxidative damage, and it will decrease the inflammation, right, in general. And doing that, so it's kind of an anti-inflammatory, antioxidant effect, stimulating the AMPK by the oxytocin. And this would help to, if you have inflamed pancreas, it will decrease the inflammation, so it produce more insulin. But also in the body, the insulin receptors, they become more sensitive because the insulin receptors, they get blocked by oxidation. And so if you're able to decrease the free radicals, you decrease the oxidation of those receptors, you increase their sensitivity. And definitely this will cause the drop in the blood sugar, right? Increase the sugar uptake. And in addition to that, as you see it here, that oxytocin stimulate the lipolysis, and it helps to decrease it stimulate the fatty acid oxidation, and also it decreases the inflammatory process of the white fat cells. We know the white fat cells, they're producing a lot of inflammatory cytokines, and they produce a lot of free radicals. So definitely oxytocin would help in dumping all this inflammatory process. And doing that, you will be decreasing the LDL and the cholesterol by decreasing the fatty acid oxidation, burning those fat, and decreasing and turning those white fat into brown fat, right? All these good things that we're going to learn in the coming slide as well. And all of this would help to manage atherosclerosis, right? So if you decrease the inflammatory process, if you improve the endothelial function, if you decrease the LDL, the cholesterol, right? All of this will help to manage the atherosclerosis here. In addition to that, oxytocin increases the nitric oxide, and it buffers the redox. So this is good for managing the myocardial infarction angina, because nitric oxide is a vasodilation, right? We actually treat angina by giving them nitroglycerin. So oxytocin is a nitric oxide donor, by the way. So it's like nitroglycerin for the heart. In addition to that, if you decrease the inflammatory process of the white fat by turning into brown fat, and you decrease the free radical productions, and you decrease the inflammatory cytokines, definitely all of this will stimulate the muscles regeneration and anabolic process of the muscle and the protein building up of the muscle. So oxytocin helps in increasing the mass and regeneration of the muscles. So this just shows you the whole mechanism here. And oxytocin also inhibits the mTOR. And if you have the mTOR, what would happen is stimulate autophagy, right? And you get rid from all the senescent cells, cancer cells, inflammasomes. And this will also stimulate the mitochondrial renewal, because that's one of the way is the autophagy possibly mediated by mitophagy. And so oxytocin stimulate the mitochondrial biogenesis and activation. And when you activate the mitochondria inside inflammasomal cancer cells, it will induce mitophagy, and it will blow up those and kill those cancer cells, and induce autophagy for those bad cells that you need by decreasing the mTOR signaling of activities there. We can go more in chemistry possibly next time, but that's just in general here. But in general, oxytocin, just by knowing it inhibits the NATH oxidase, which is the enzyme that produces the free radicals. The NATH oxidase stimulated by sympathetic, right? When you have too much sympathetic, you have too much of activity of NATH, produce too much of free radicals, which will aggravate any existing inflammation or induce inflammation. And just inhibiting that, and inhibiting the Th17 and M17 interleukin 6, and inhibiting all this inflammation mediated by interleukin 6, we can manage all chronic disease across all medical specialties. We can start across the aging just by knowing it buffers the redox, and it modulates the immune system by inhibiting the NATH and decreasing the free radical generation, and by inhibiting this bad inflammatory process, extra inflammation of Th17. I mean, we need Th17, of course, we need neutrophilia, but we need it to be to a certain degree where it helps us to kill the bacteria or the fungus. But too much of hyperinflammation, too much of interleukin 6, and too much of overactive of this inflammatory process mediated by Th17, M17, interleukin 6, it's not good. Then it becomes self-destruction, right? All this neutrophils start secreting proteases and hydrolytic enzymes and peroxisomes and all that, and cause more damage. You want to suppress that, right? You don't want to have too much of inflammation that causes self-destruction. And we find out that rheumatoid arthritis, yes, it's Th1 dominant, but also it has some Th17 components. and this is Th1. And we find out that systemic lupus is Th1, but it has Th17 dominant. So we can, so oxytocin can be used for both, and we can get rid from this overactive Th17 neutrophilia that's causing damage of the joints and in both sides of the aisle, right? Or the dementia, we have inflammatory process, and part of it's Th17 interleukin 6, right? And we can slow the process of inflammation, destruction, and degeneration of the neurons just by blocking the interleukin 6, along with blocking the NUX enzyme as well. So we can use it for even cancer. Cancer, for example, if the inflammation is polarized into Th17 interleukin 6 neutrophilia, you cannot really kill cancer with neutrophils, right? You need cytotoxic T cells. So if you block this, then what will happen? Your immune system will resume its polarization into Th1 and cytotoxic T cells to kill those cancer cells, right? Using cytotoxic T cells. And so it helps to modulate the immune system in a physiological process where you get rid from those cancer cells and those pathogens. At the same time, dump it in a way to not be hyper inflamed and hyperimmune. And that's what's happening with COVID. If you see COVID virus, normally when we have virus and we be attacked by virus, your macrophage will eat the virus. And the macrophage, when they eat the virus, they use what we call the toll-like receptor as a taste bud. And normally those macrophage, when they degrade and they taste the virus, they polarize into M1, and they will secrete interleukin 12, and they will secrete interferon gamma, and that will polarize the lymphatic system into the lymphocytes into naive lymphocytes into Th1, right? And then Th1 will stimulate the cytotoxic T cells, and that's how you can get rid from those cells that's been infected with virus. COVID virus is so smart. Okay, so it's fooling our immune system. It's not like flu virus. Flu virus, you get Th1 high. You don't get Th17. When you see Th17, that's mean and interleukin 6, that's mean it's bacteria infection. So this COVID virus, it's so smart. It's fooling the system. It's fooling the immune system to protect itself, so they can proliferate and they can spread in the body and destroy the host. So what they would do, they will fool the immune system and polarize the immune system into Th17 neutrophilia. And really, you cannot get rid from this virus, especially the intracellular virus, with neutrophils. You need cytotoxic T cells, but they will fool the immune system and make it polarized into Th17 and neutrophilia. Right, that's what you see in COVID. Right, you see neutrophilia, you see interleukin 6, you see the D-dimers, because interleukin 6, when it's overproduced, it stimulates the clotting process. So it definitely leads to increase of D-dimers. So how it's fooling the system, right? So normally the macrophage, when it takes the virus, it's supposed to be polarizing into M1, Th1. It's the spike protein. The spike protein, it blocks the ACE2. And what is the ACE2? ACE2 is the angiotensin converting enzyme, right? And ACE2, it's part of the renin-angiotensin system. And renin-angiotensin system, before we think, oh, it's just a process to control the blood pressure, right? So when you have a drop in the blood pressure, your kidneys do secrete renin, and then renin convert angiotensinogen into angiotensin, and then angiotensin will convert into angiotensin 2, angiotensin 1 to angiotensin 2 in the lung, right? You remember that? Okay. And then angiotensin 2 is the vasoconstrictor, and it increases the blood pressure. That's what we learned in medical school. But now it's different. It's not just a vasoconstrictor, angiotensin 2. It's also it's an inflammatory signal. When it reacts with angiotensin 2 type 1 receptor, the signaling is not just causing vasoconstriction, but it's also causing inflammation. And which kind of inflammation? We have 3 kinds of inflammation: Th1 mediated inflammation, Th17 mediated inflammation, Th2 inflammation, right? Th2, which is the allergy. Th17, we use it to fight the bacteria and fungus, and Th1, we use it for fighting the inflammation, to fight the cancer and virus. And so what happened is that the polarization is of when you stimulate the angiotensin 2 type 1 receptor by the angiotensin 2, it polarized more into Th17. and in neutrophilia. So that's kind of inflammation that's moving. And so the spike protein blocks the ACE2. What is ACE2? Is an enzyme that converts the angiotensin 2 to angiotensin 1-7. And so when it turns into angiotensin 1-7, angiotensin 1-7 is actually a vasodilator and anti-inflammatory. So in a renin-angiotensin system, there's two arms and two receptors. There is the inflammatory arm, where the angiotensin combined with angiotensin 2 type 1 receptor, right? That cause vasoconstriction and signaling of inflammation, especially polarization to Th17, M17, and interleukin 6. And then there is the other arm, with angiotensin 2 can also convert into angiotensin 1-7, and then angiotensin 1-7 will react with mast receptor and induce the vasodilation and anti-inflammation, which opposing the angiotensin 2 type 1 receptor. There is another group, another side, another arm of angiotensin system, which mediated by angiotensin 2 type 2 receptor and ACE2. They combine together, and they turn the angiotensin 2 into angiotensin 1-7. And that's the anti-inflammatory peptide. That's the dihexa, right? And so it's good to add dihexa when you're managing COVID. Why? Because the COVID spike protein blocks the ACE2, blocks the anti-inflammatory arm, blocks the vasodilator arm of renin-angiotensin system, leading to overactive angiotensin 2 type 1 receptor, which signals vasoconstriction, which signals sympathetic overactivities, right? And sympathetic release norepinephrine stimulate the NOx and generating free radicals and causing more inflammation. And it stimulates the polarization of the immune system to Th17 and neutrophilia. So it's all caused by the spike, blocking the ACE2, the anti-inflammatory arm of renin-angiotensin system, allowing this overactive angiotensin 2 type 1 receptor signaling that leads to neutrophilia, to polarization of the immune system to Th17, to interleukin 6, and interleukin 6 stimulate the clotting, the thrombocytosis. And that's the reason we have the high D dimers in this patient. That's why we have hyperinflammation. But what kind of inflammation? The inflammation that has too much of neutrophils. That's why we see neutrophils. Normally, neutrophilia is seen in bacteria, not in fungus, not in virus, but it's fooling the immune system and it's polarizing it from the right immune response, which is supposed to be polarizing into Th1 and cytotoxic T cells to get rid from this virus. And so that's the reason we propose losartan and hydroxychloroquine and ivermectin, because all these drugs do inhibit the Th17 polarization. That's why we use ivermectin to manage rosacea, right? Because rosacea, it's inflammatory and most of it's Th17. And we use it for managing also systemic lupus, because part of systemic lupus inflammation is Th17. It's FDA approved hydroxychloroquine to be used for systemic lupus, because the inflammation of systemic lupus is Th2, Th17. So you're blocking the Th17 part by using hydroxychloroquine. But those people, and Dr. Fauci, he does not know that there's 3 kinds of inflammation. He does not know that the inflammation that is caused by the COVID, it's Th17 dominant. It's the same inflammation that rosacea is producing, the same inflammation that systemic lupus is producing. That's why we use the drug of the rosacea, which is ivermectin, and we use the drug of the systemic lupus, which is hydroxychloroquine. But those people, they either they don't have any clue what they're talking about. They don't talk about mechanism of action. They are doing clinical trials, but maybe because of my personality as an INTP, I like to dig deep into a mechanism of action as a start, and then I will do clinical trials to back up the mechanism of action. And it has that synergy, like me and Dr. Petra McCullough and all this group. We have that understanding. I mean, they are very good in clinical trials and bring all the studies, but I like to back what they are saying with mechanism of action. That's because I'm introvert, not an extrovert. And so knowing that, we can use oxytocin to manage COVID, okay? COVID infection. Why? Because oxytocin is not just it's anti-inflammatory and TH17 anti-inflammatory drug. Not just that, it also inhibit the directly and indirectly, it inhibit the binding of the spike protein to the ACE. So it inhibit the blockage of the anti-inflammatory arm of renin-angiotensin system, right? So it's balancing the renin-angiotensin system and preventing the overactivation of the inflammatory arm of renin-angiotensin system, which is mediated by angiotensin 2 type 1 receptor. So it's an anti-inflammatory, it's antiviral, right, by blocking that. And not just that, it also stimulates the mucus secretion, nasal mucus secretion, and the quality of the mucus secretion, which it produces the lactoferrin, and the lactoferrin will form a complex with the spike protein, preventing it from attacking ACE2. Not just that, oxytocin stimulate the inhibit the protease that is responsible to prime the spike protein in order to react with ACE. So it does have antiviral effect. So it's good, right? Same like McCarran Blvd, same like ivermectin, oxytocin can do the same job. But it's better because it increases the mucus production, the tear production. It increases the parasympathetic, which is the anti-inflammatory part of the autonomic nervous system. So can you tell me which is better, McCarran Blvd, oxytocin? Well, you know, there's McCarran Blvd has something extra, which is the photodynamic therapy that oxytocin does not have, but the rest, oxytocin is better. Okay, as an anti-inflammatory and increasing the mucus secretion, all that stuff. But McCarran Blvd have an extra of photodynamic therapy. It's good to use it together. And that's what we do. We combine them together, by the way, and use it intranasal. But it's better than oxytocin, better than hydroxychloroquine, and better than ivermectin because it's natural product and does the same thing that those two drugs does, right? So it does have anti-inflammatory effect, as you see it here. And it does stimulate the expression of antioxidants, and it inhibits the NOx enzyme, so you can get rid from all this peroxides and peroxynitrates. And so, which is the reason why we have this failure of multi-organ failure of the COVID, because of this mass hyperinflammation and activation of sympathetic and inhibiting the antioxidants and stimulating the oxidants. As you see it here, that leads to multiple failure of organs and all that. And we can inhibit that by using oxytocin, and not just inhibiting and treating COVID, but also preventing it. Because when you do the intranasal oxytocin, you increase the secretion of the mucus and the lactoferrin, you are trapping those viruses, preventing it from attaching to the ACE2. So it's a preventive. I wish if we know this before, we will be definitely put it as part of the protocol, and maybe the first line treatment for COVID is oxytocin, and then we use McCarran Blvd. And at that time, we did not have that much information. Now we know. So any infection, any viral infection, any infection, it's good to be adding oxytocin as the first line treatment because of increasing the mucus production, the quality, and it's anti-inflammatory because it also enhances the production of immunoglobulins as well, immunoglobulin A, the secretory ones. So we want to be making sure that if you want to be protected against the flu viruses and the COVID and all that stuff, start using, especially during the winter, start using oxytocin along with vitamin D and things that we know helps in preventing infection. Okay, so what's the time now? 9:30. When I come to 10, we can stop at 10. 2 hours will be enough, and then we can finish out the next session maybe next time. But I don't want to, overload you with all this information. I did the same thing yesterday in my session. They stopped me at 10 because it's too much, and people, they want to digest the information, and then they want to apply it on their patients, and then we want to hear it from you guys. So, and I like this interactive, reactive relationship between us, so we can learn from each other. It's not going to be one way. So it's a protective effect of oxytocin through its anti-inflammatory antioxidant role in the model of sepsis-induced acute lung injury. So if I have two groups of mice, and I induce injury in the lungs of those mice by injecting, for example, bacteria like polysaccharides in both group of mice. Two group of mice, right? And I inject the bacterial-like polysaccharides in both of them. I want to induce damage, inflammation into the lung. And then I inject in one group, I will inject oxytocin, the other one no oxytocin. And then we'll see that the mice with oxytocin, they survive longer than the one without. And then I take their lungs and I dissect them, and I can see that the damaging effect of the bacterial-like polysaccharide is going to be less. The inflammatory process, the fibrosis, the damaging is going to be less in those lungs that's being sliced from the mice that's being exposed to the oxytocin versus the one without oxytocin, right? So this gives me an indication that I can use to manage all kind of respiratory disease, where it's inflammatory, septic, fibrosis, because interleukin-6 mediate the lung fibrosis, by the way. So I can use oxytocin in managing all lung diseases, ischemic lung disease as well, because it has its vasodilation effect, antioxidant effect, so it will inhibit the reperfusion damaging that's happening because of the oxygens and turning into free radicals, and that leads to damaging what we call the reperfusion injury effect of the ischemia, especially after they get they open up those blood vessels after ischemia. Then you would have a flow of oxygen with the blood, and oxygen would turn into free radicals that cause more inflammation, more damage. It's called the reperfusion injury. That's happening in the lung and also can happen in the heart. And oxytocin will help that, will prevent that. So I can use it for both lung ischemia and which like pulmonary embolism, and possibly I can use it for angina and myocardial infarction. And really, I can use it for any inflammatory process, any degenerative, any autoimmune, any inflammatory process in any organ, any chronic disease affecting any organ, where it's degenerative, autoimmune, inflammatory, allergy, name it, right? Oxytocin can be an adjuvant, or it could be the main treatment, and it does help to stall the process of the damaging and heal, and helps in managing all this inflammatory process, because if it's anti-inflammatory effect, because if it's vasodilation effect.
The dose and how to use it.
What is that?
Still have some?
Yeah, just.
All right.
All right. What's the dose and how do you administer it?
We have two route right now. We think it's the best way of doing it. Intranasal, which Dr. Mike Beamer is producing it, up to 100 international unit per day. So basically, you can spray twice at night, and then twice during the day. That's the max. Gives you around 100 if you puff them two times in one nostril max. But if you want to just start with just puffing it once in each nostril at night, and then you can go up to twice, 2 times, and that gives you up to 100 international unit. So he has the vial that contains 3,000 international units, so it's enough for 30 days. Or you can inject it. Well, it's very important to have the intranasal part, because you want to get the oxytocin to the brain and get that the good effect of oxytocin on the central nervous system. But also you want to give some peripheral effect more also when you are doing weight loss. So injecting up to 10 international units around the umbilical. Start with 2. That's another way. Up to 10 for subcutaneous.
Dr. Halasa, let me summarize for the questioner here real quick. So what we came up with, guys, is in the studies that the normal dosage is 12 to 24 units at a time. And so what we did is we designed it in such a way that one spray of the nasal spray delivers 12 units, since that's the amount generally discussed in the literature. So then you can multiply that out, the action of the drug is just a few hours. Maybe it peaks in about 1 hour, and then it slowly goes down over the course of about 3 or 4 hours. So after about 4 hours, the drug's mostly worn off. But it also has a positive feedback loop. So when you stimulate the oxytocin system, it causes the body to release more oxytocin too. It's like, when it sees there's some happening, it sometimes will increase it more. but 12 units in each nostril, so total 24 units in the morning, and then repeat that at bedtime. And that's what most people have been doing and getting a good effect. So that's a total of 48 units in a day. So it's a very conservative dose. And, if you needed to go up from there, you surely could. The other aspect would be that, to consider the patients, if they have other problems with their nose. In other words, before you give a nose spray, so make sure and ask them, do you have problems with your sinuses and nose that might, cause us to think they won't work well for them? But I haven't really had much of that. So 12 to 24 units AM and PM is a good starting point. You can double it from there if you wanted to and still be at 50% of the maximum dose. And then the other thing I would say is if you wanted to start conservatively, do it at bedtime, right? Just do one spray in each nostril at bedtime. And then say, do that for a week or a few days. And when, if the patient's doing okay, then, bump it up to using it in the morning too. But we haven't had any problems. We also offer it with methylene blue mixed with the oxytocin. And that's got some fans when we talk about photodynamic therapy and other things we can do. The intranasal oxytocin probably has around 5% of the dose gets through. So that puts it in line with the injectable dosages too. So, but it goes directly from the cribriform plate into the brain structures of the olfactory nerve center and the facial nerve. Can't remember the name of the nerve at this point. The facial nerve. I forgot the name of it. That also shares the cribriform plate with the olfactory nerve. So those are the two methods by which the drug gets through into the brain, and it enters the spinal or the CSF at that point. But anyway, that I just wanted to clarify that pharmaceuticals part of it, because Dr. Halasa has done a lot to show what the drug can and can't do. But you're right, we need to temper that with a little bit of practical something. So anyway, thanks for letting me interrupt.
Thank you very much.
Hey, Dr. Beamer, I thought the last night, how maybe it wasn't going through when I put the orders through, but I thought I was putting the orders through. Well, I intended the orders to be 2 sprays in each nostril at bedtime for the patients. And then I thought we said, well, we can do twice a day. So I thought it was 2 sprays in each nostril, BID, but you're saying it's 1 spray in each nostril, BID.
Right. And most of your prescriptions have been coming through as just at bedtime. That's how Debbie's sending them, and that's fine. So you might just, next time you speak to your patients, let them know that if they were doing well, they could increase it to AM and PM. But I will agree, most of yours were ordered that way. Although I think we've seen
but I intended them to be ordered 2 sprays in each nostril.
Well, you have enough
bedtime.
volume to do that, Dr. Joseph. He's putting 3,000 international units, so it will be enough to do that.
There's 3,600 units in a bottle, right?
Yeah. So when we discussed it yesterday, so that's sort of the idea is if we build ourselves up, we kind of want to do 2 sprays in each nostril twice a day, because that's the maximum dose, correct?
That's and you want to do it the personalized way, so that the patient will. You want to see your patients how they feel about it. You want, because we are the frontier and leading this, so we are establishing those protocols, and we want to make sure that you don't give them the high maximum dose, and they may end up with some problems that we don't aware about. So we start with slow and we go up. You got my point?
Yeah, and that's sensible. Dr. Joseph, your dosages have been 24 units typically. And if you bump them up to twice a day, then you go to 48. We're kind of recommending
my doses have been 2 sprays in each nostril. So that's 12 and 12 and 12 and 12. That's 48 units QHS. That's what I was ordering them as, because it's 2 sprays in each nostril.
We need to talk to Debbie about that, because they're not coming through that way from her.
Okay.
But I'll
that's what I figured was the.
Yeah. But I didn't know. Yeah. But we'll talk about that. I can fix all that for you. That's no problem. But the recommendation basically, and what you did is fine, to start with once a day and then go to twice a day. But yeah, you're at 24. You could go to 48 real easy. That's no problem. We've had no issues with that. We have had some people doing a little bit more than that for tinnitus and some other, like, I guess conditions where we know the patient has a condition that in the literature there is a higher dose merited, tinnitus being one of them. So we have a few people doing that, but really most people are AM and PM, and it's doing great. The feedback has been very good. We should talk more about it, but and I'd love to hear from people what their patient responses are, but everything I've heard so far is good. We had one case of tinnitus where the patient felt it made it worse, but they only did it for 2 days. So I don't know really what the outcome of that was. That's just kind of a failure, treatment
Well, I
failure.
have Dr. Farshan reporting the opposite. He said, I have a patient with tinnitus and they feel better. And actually, he
I've
wants to
heard
do more.
so that's a tougher condition. I'm sure there's many causes of tinnitus. Some of them, hearing loss could be permanent from, gosh, I mean, it depends on what injury has been caused it, so. But
well, the other thing is some of the things when we look at the pathways, some of it is immediate gratification, but the other parts are consistent with regenerative medicine, where it takes 3 to 6 months to regenerate anything. Well, really 6 months, and so if things that are stimulating autophagy, stimulating the bone marrow, things like that. I can imagine that, or there's just even cardiac repair. I mean, I was just reading an article that it's the epicardium, right in between it's part of the pericardium, inside part of the pericardium, is the area where the cardiac muscle precursor or progenitor stem cells are. They can be stimulated, especially with acute cardiac injury. Those are regenerative processes, or healing of, if the brain has a lot of neuroinflammation or chronic pain causing structural changes within the brain, such in areas where oxytocin normally affects parts of the brain that may be involved with neuroplasticity and perception of pain. And I'll leave it at that. But those processes take time. So, I can imagine that there's long-term benefits that remain to be seen, and then there's some of the immediate benefits where it does help with acute pain. We've seen that. My mother said her sacroiliac joint pain is so bad in the morning, it gives her the dry heaves, and within about a half an hour to 45 minutes after doing the oxytocin, the pain goes away. And she's somebody who knows, she's tried all the different things. And so she knows that this is very effective. And so that's what I'm saying. I think there's more to it. We can't draw a conclusion after 2 days. You know what I mean?
I agree with you 100%. I think it takes, several months and if you look at the drug itself, and it reminds me of, the more we look at it, of it's almost like the other hormones or a nutraceutical. It does a million different jobs, and by the end of review, what is the outcome of what are the prominent clinical features out of all these things, and I think that's something that remains to be seen. But I think we're seeing that, just like every other hormone, if you have no testosterone, you don't die. If you don't have any estradiol, you don't die. And likewise, there's no medical illness that's specifically kind of caused by low testosterone. You have the syndrome of all these various different degenerations that occur when we don't have a hormone. So I think that's kind of the way I look at oxytocin. It's like another hormone. It's not 1,000% critical that if you don't have 100% oxytocin system function that you're going to just die or get some disease. You're not, but you're just going to be debilitated. So it's just like having low estrogen, just like having low testosterone. There's a multifaceted thing that we're learning about here, and I don't know that it's well defined as to what it does exactly, but I bet we're going to find out.
Mike,
Oh yeah.
I was wondering, have you seen patient say the onset of action is within 20 minutes, but the effect does not last beyond 30 to 40 minutes. So
Yeah, Dr. Patel, I don't disagree with you. You know, like I've looked at the pharmacokinetic charts, and it does, it has its maximum effect in about 1 hour, and then it precipitously drops off around.
Well, that's
by,
the euphoric effect that you're feeling, the patient.
yeah, right.
Maybe the
And then by
serotonin,
3
dopamine.
hours, the drug's mostly out of your system.
But the healing effect is not dropping. It's processing.
Right.
It's
No,
continuing
but
because
like effect, like I'm talking about headache. When we give the patients
Okay.
with the chronic headache, you can break the headache within 20 minutes. But then if it lasts 30, 40 minutes, I told her that just use it every hour until.
I think you're right. I think you're right, because up to a reasonable dose. So will 24 units alleviate the headache for an hour?
Yeah, that's what she says. She has a
Okay.
the class for 1 hour. Then instead of increasing the dose, just if we increase the frequency.
Yep, I agree with you about that. I would just I think what I would do though is maybe a maximum every 2 to 3 hours for 4 days.
It may take maybe 2, 3, 4 doses, and then probably
Yeah.
it may last little longer. But I was just wondering that how often you see the receptor insensitivity, because that is one of my concern.
That's a tough one. I just don't know. I don't have any. I just haven't seen any data.
well,
on
we're
that.
going to talk about migraine, maybe not this time, but maybe the next Monday because of the timing thing, and we still have.
Well,
30
I'll
minutes.
tell you this, Dr. Patel, on your question about headaches. I met a neurologist who is a headache specialist from Birmingham, Alabama. And I've developed a conversation going on with her. And she's very interested in oxytocin for migraine headaches. So, and she's done some research on it. So I will, I'm hoping that we will be at A4M and she will be there. And I'll have a chance to visit with her again. But I've forgotten her name at the moment. I got it in my email. But this is somebody who's very interested and has studied oxytocin for migraine headaches. So maybe they would be able to tell us. I know one of her interests is in getting more bioavailability out of the nasal spray. And she suggested that there are some products out there that are like unit dose little nose sprayers, sort of like they use for the opiate reversal drug, you know, that the paramedics have. They put it in your nose, they squirt it up your nose, but it's like a real it's a lot more than a nasal spray, put it that way. And she was saying maybe look at that. I don't know. I haven't done it yet, but
it's a delivery spray that gets into the coliform plate, so it gets
that's kind of what
into the bottom of the skull.
That's an area where we could do some improving. So that's the level. That's. But anyway, that's something.
Well, the photodynamic therapy is another option, but we're gonna talk about the oxytocin. As I said, it's increasing the dopamine and serotonin, and it gives you that feeling of instant relief and happiness and thing, and then it wears down. The happy molecule maybe that wears down, but the efficacy of oxytocin, it will continue because it's changing the epigenetics and the expression of the genes and the protein machinery of the proteins in your body. But it takes process. As I said, it's a regenerative process. It's expression of protein and all this. It takes time to be built up. So maybe, yes, you know, increasing the frequency, but eventually the long-term effect of oxytocin will be built up from the expression of increasing the expression of the epigenetics that would change and modify the expression of antioxidant enzymes and anti-inflammatory cytokines. And as you see here, I mean, it's a very good cardiovascular protective drug. If somebody has ischemia or angina or myocardial infarction, I mean, it does everything. It increases the nitric oxide, so it helps to increase the blood flow. It's analgesic as equivalent as morphine. It regenerates the muscles. It stimulates the stem cells of the muscles, so it fills up that gap of the necrosis. And also it has antifibrotics, so you get rid from the scar tissue. You don't want that. And it's antioxidant, so it buffers the redox. It's increasing the parasympathetic, so it has anti-inflammatory. It slows down the heart, which is very important when you have myocardial infarction and angina. It increased the endothelial function and increased the nitric oxide bioavailability. I mean, increased the nitric oxide production. It does has, as I said, anti-inflammatory, so it's good for any lung disease or even lung fibrosis, lung infection, inflammation, allergy, whatever. It just helps in all different aspects and managing all those inflammatory process. And it's good for fatty liver as well, and it gets rid from the fat. It's good for metabolic syndrome in general, whether it's hypertension, weight, or obesity, or diabetes, or and because it also stimulates the heart to secrete the natriuretic peptide, so it helps to get rid from excess of fluid and excess of salt. So that's good for the heart, especially when you have heart failure. But it's just good for blood pressure as well. So it just have general cardiovascular protection, and it's a good drug for managing metabolic syndrome in general. So again, we talked about COVID mechanism, and we know that oxytocin, it can be used to prevent the infection by stimulating the secretion of the mucus and the lactoferrin. We're going to see that in the coming slide, and how it's inhibiting the protease, which inhibit the priming of the spike protein, and so it has an antiviral effect by doing that. In addition of its anti-inflammatory, it's antioxidant. We talked about inhibition of the Th17, interleukin 6, and increase their Tregs, and inhibiting the inflammatory cytokines, and stimulating the anti-inflammatory cytokines, and stimulating the Tregs. All of this helps to decrease the inflammation, and restore the homeostasis, and reverse the pathophysiology of the COVID. And we talked about all of this, and this is just to show, how the COVID virus spike protein, how it interfere with renin-angiotensin system, how it's increasing the activity of the angiotensin 2 type 1 receptor signaling, which leads to the inflammatory cytokines, which mainly is Th17, M17 ones, and how this virus, it's causing inflammation, hyperimmune response and inflammation, especially Th17 dominant interleukin 6, all over the body. I mean, all organs of the body, which leads to multi-organ failure, including the lung and the heart, and it leads to myocarditis, it leads to encephalitis. It aggravates any underlying chronic disease. It makes the hypertension more worse, atherosclerosis more. And so it's a really devastating disease because of the effect of the spike protein and hijacking the renin-angiotensin system. And of course, when you hijack the renin-angiotensin system, what will happen? You stimulate the overstimulate the angiotensin 2 type 1 receptor signaling. That leads to activation of the sympathetic. When you have overactivation of sympathetic, release of norepinephrine, and that they stimulate the NOx and generate free radicals, and cause more and more inflammation here. And what oxytocin does, oxytocin inhibit the sympathetic directly and stimulate the parasympathetic. It inhibit it blocks or inhibit the blockage of the ACE2, so it restores the renin-angiotensin system back to normal activities, especially the anti-inflammatory arm, and it suppresses the inflammatory arm by doing that, and so the angiotensin 2 can convert into angiotensin 1,7, which is dihexa. That's the reason I will like to add in the protocol of managing COVID, adding dihexa, and it will be good if Dr. Mike Beamer can develop the intranasal dihexa versus the oral dihexa, which is the angiotensin 1 and 7. I think it's angiotensin 4. That this is anti-inflammatory versus angiotensin 2. As you see, the oxytocin increases the stimulation of estradiol, which is very important. It does stimulate the mucus production and the lactoferrin, as you see it here. And the lactoferrin, it's very good because it will react with the proteoglycans, and it will interact with the spike protein and prevent them from blocking the ACE2. In addition to that, we see oxytocin stimulate inhibit the serine protease, which prevent the priming of the spike protein and reacting with the ACE2. we know that oxytocin stimulate the thymus and stimulate the release of the thymosin, possibly alpha, and helps to balance the immune system, possibly inhibiting the Th17 and stimulate the polarization of the immune system into Th1 and cytotoxic T cell, which is very important to kill the virus and get rid from it. In addition to that, we say that oxytocin stimulates the parasympathetic stimulate the tears and secretion, the saliva, and the quality of it, because it will increase the lactoferrin inside of them. And this will help to neutralize those viruses and prevent the virus, in addition to managing it. And this is just, again, how COVID is affecting the whole system of the body, and how the oxytocin, it helps to reverse it, reverse the pathophysiology of the oxytocin. We talked about that oxytocin helps to, it's a cardioprotective drug. It's also respiratory protective drug. And also it's a neuroprotective drug as well. And they made a study experiment where they have two groups of mice. One group they injected with the same thing, the lipopolysaccharide bacteria, the other one lipopolysaccharide bacteria by lipopolysaccharide. So you inject the toxins into just two groups of mice, and then you inject oxytocin in one group and none in another group. So we find out that the mice with oxytocin, they survive longer. And then when we dissect the brain of this true group of mice, we find out the one with oxytocin, they have less inflammation, less microgliosis. And so it does have anti-inflammatory effect. It decreases the turning of the microglia into gliosis and inflammation. Knowing that, then I can justify using the oxytocin to manage all the neuroinflammatory disease of the brain, systemic multiple sclerosis, even degenerative disease, dementia, because there's part of inflammation there. We can use it for Parkinson's disease. We can use it for encephalitis, and because all of the oxytocin does help in as an anti-inflammatory. It helps to alleviate the microgliosis and restore them back into microglia. In other words, it's an anti-inflammatory effect there in the brain. So I think it's a good drug for as a neuroprotective for managing degenerative neurological diseases and inflammatory diseases. And you can see how the oxytocin blocks the inflammation from the start. You know, the inflammation starts when the macrophages start eating those lipopolysaccharides and tasting it using the toll-like receptors, you see there. And then that will irritate, inflame, or turn those naive macrophages or microglia into which direction. In case of lipopolysaccharides, it's coming from the bacteria, so those microglia or macrophages, they become what? M7 microglia, M17 microglia 17, which polarize the whole naive T cells into Th17 and interleukin 6. And you see that how oxytocin is inhibiting the inflammation and the turning of those microglia into gliosis from the start, from the time they combine with the lipopolysaccharides. As you see it here, they're blocking the whole signaling and transformation of those macrophages into active macrophages. In this case, it's going to be turning into mostly M17 and microglia 17, which will secrete the interleukin 6, which will polarize the naive T cells into Th17, right? You get that stimulation of neutrophils and neutrophilia. Okay, so we see that oxytocin, it does help to increase the expression of antioxidant enzyme. It inhibits the oxidant enzyme, the NOx enzyme. It inhibits the expression of oxidant enzymes. It stimulates the expression of anti-inflammatory cytokines. It inhibits the polarization of the immune system into Th17 and interleukin 6, or decrease interleukin 6, as you see it here. And so it's a powerful anti-inflammatory drug, right? And also it stimulates the GABA, and the GABA, one of its mechanism, it blocks the calcium entry, and so blocks the whole irritation, inflammation, because calcium influx excessive can lead to release of the free radicals from the endoplasmic reticulum and initiate the whole inflammatory process. So GABA drug or GABA receptor and GABA drug is not just suppressing the pain, but also it decreases the inflammation as well. And oxytocin enhance the GABA receptor and the expression of GABA and activity of GABA. And it inhibits, as I said, the anti-inflammatory cytokines, especially Th17, which is interleukin 6 and interleukin 1b, and also the tumor necrotic factor alpha here. And so I justify using oxytocin to manage all neuroinflammatory disease, whether it is degenerative, because inflammation is part of degeneration, or the autoimmune like multiple sclerosis, or and the other thing of the use of oxytocin, we can use it for dementia, and we can use it for dementia. We can justify it because oxytocin does inhibit the activity of acetylcholinesterase, which means it increases acetylcholine bioavailability. So that's number one. So the neurologist will come to you and say, oh, how oxytocin would work for dementia. I mean, dementia, we have less of acetylcholine. Does the same thing like the drug that we're giving to inhibit acetylcholinesterase inhibitors? And say yes, it inhibits the acetylcholinesterase and it increases acetylcholine bioavailability. So this will justify using it. Now, the other thing, dementia pathology, it's because of misfolding of the proteins, whether extracellular, which is the plaques, or the intracellular, which is the neurofibrillars, and the tau proteins. And oxytocin does inhibit the misfolding of those proteins into the tau protein or the plaques. And even if they form those misfolded protein, intracellular, extracellular, it helps to recycle them as well, oxytocin. Along with, you add methylene blue with curcumin, with oxytocin, I think you can get the best results of managing dementia. So oxytocin works in all different angles. It works in anti-inflammatory, it balances the immune system, so it's inhibiting the Th17 and possibly shifting the Th1 into Th2. That's what you need, and increasing the Tregs. That's what you need to manage dementia. And also it inhibit buffer the redox, and it inhibit those oxidant enzyme and increase the expression of antioxidants, and so you can clear all those free radicals that induces apoptosis and degeneration, speed the process of degeneration. So you're working on the redox, you're working on the immune, and then metabolically, you are working on increasing the acetylcholine by inhibiting the acetylcholinesterase. So it works with the three pillars that we are using to manage chronic diseases. And this just shows you how the oxytocin inhibiting all the signaling process and the pathway that lead to the misfolding of the tau protein and the beta amyloid proteins and formation of the plaques, extracellular or intracellular to the neurofibrillary tangles. Okay, what's the time now? Is it 10? And if it's 10, we need to stop. So we have another 9 minutes and then to stop, and we can finish maybe next time. Okay, so we said that we really don't have much of studies and clinical trials of using intranasal oxytocin to manage patient with Parkinson. But we have Dr. Patel here. She's using it for patient with Parkinson. I think the patients experienced great results, along with using dihexa, because dihexa also helps to inhibit the inflammatory process. We know that dihexa is the angiotensin 1-7, right? And that will inhibit the Th17 and interleukin 6 as well, because it's the other arm of the angiotensin system. It's the anti-inflammatory arm. And so using dihexa, using oxytocin, I think, and even using some NAC for those patients to neutralize all those free radicals. We know that the Parkinson is because of degeneration of the dopaminergic neurons and inflammatory process. And let's say, for example, the patient will develop manifest Parkinson if the 75% of their dopaminergic neurons are inactive. Most of the time, 50% of them are completely dead, and then 25% are stunned by inflammation, and what's being functioned is 25%. And it's not enough really to put the brake on the muscles, and so you will have this excessive movement of Parkinson's disease and shivering because you don't have much of brakes that the dopamine does in adjusting and toning the muscles, so it moves in a smooth way. And so you have the patients are having this tremor thing of the Parkinson. But if we are able to reverse the inflamed or the stunned or inflamed neurons that's been stunned by inflammation, the 25%, I think we can help, decrease those manifestations of Parkinson's disease and possibly reverse it. I'm not talking about completely reversing it because you have 50% already been dead, but the 25% that's been stunned, we can restore their function by giving IV glutathione. But too much of IV glutathione is not good because you would have too much of glutamate, and glutamate will stimulate the glutamate receptors and causing more calcium influx and more inflammation. So it's good for short term, but using it too much is not good because of the glutamate toxicity. Unless you're adding NAC to it, possibly it helps to recycle the excess of glutamate. I think you saw a doctor, his name is Dr. David. He used IV glutathione, and you can see the instant relief of the tremoring and shivering of the patient with the Parkinson. But you cannot really do it too much because of the glutamate, unless you add NAC to recycle it. But we can also use other.
Halasa, you don't see that response all the time.
Right.
I have seen in that patient 1 or 2 times, and then it just stopped.
Right.
So just for those who are listening, just I want them to know that
right,
it is
and that's
not
because
going
of the
to-
glutamate part of the glutathione. It's not good. It's toxic, and it's causing the inflammation, more damage because it stimulates the NMDA receptor, and it causes the calcium influx, and it causes activation of the NOx enzyme, generate free radicals, and causing more inflammation. And so it gives you. Remember the term that you used, the biphasic one, where you have the response at the opposite. You remember that term that you used?
Right, hormesis, biphasic response.
Biphasic response. So that's what's happening to the glutathione, and the reason is because of the glutamate. It's toxic, and so we can use other things. So you use IV glutathione one time, that's fine, but then you use oxytocin, you use dihexa, you use HCGC, that because it stimulates the sex hormones, and all of this will help in as an anti-inflammatory and possibly reverse those stunned dopaminergic neurons and gain their functions and put the brake, and possibly helps the tremor and all the manifestation of Parkinson to be reversed. And then you need to continue doing all of this. It costs too much of money, yes, to slow the progression of the degeneration of the neuron. So you need to optimize the health of the patient. Is that enough to just give the intranasal? No, you need to really see if you can detox the patient, manage the leaky gut, manage the toxins, see the sex hormones, see the vitamin D, see the vitamin B6. It's as much as you optimize the body, because they have genetic problems, and you are working against the flow of the genetic errors, and it costs too much of money. And yes, to maintain those patients, it's just and I think those people who have these problems, and anybody with chronic disease with genetic errors, they need to be having their own budget and money and funds for them, for slowing the progress of this degeneration to live longer. And it's costly. It's like treating cancer as well. Cancer is more expensive than, of course, the autoimmune diseases. And so they made a test, same thing, and instead of using bacterial lipopolysaccharide, they use another toxic drug, rotinone, and that induced a dopaminergic neuron damage, right? So they have two group of mice, and they inject those rotinone toxic in both of them, and then oxytocin in one, oxytocin and none in the other group, and they slice the brain, and they find that there is a neuroprotective effect of oxytocin in the dopaminergic neurons, which justify us to start giving intranasal oxytocin to patients with Parkinson's disease. Do we need clinical trials? Yes, we need clinical trials, and that's why you are here to help me to put together those clinical trials, even case, not necessarily clinical trials, the formal ones, just case reports. It's good enough to justify and using oxytocin, because oxytocin is being past FDA. There's safety there. We are repurposing it. Do I need to spend a lot of money and put in clinical trial to prove it? No, because it's not a new drug out of the blue. It's something we are repurposing it. And if we just have hundreds of cases showing it's effective, then yes, it justifies us to repurposing it and doing it. It's legal and you can do it. As a doctor, repurposing drug, it's legal for you to do it. And if you see the benefit of it, do it, please. So oxytocin does modulate the microglia and have the microgliosis. Again, it promotes the GABA, and GABA is not just inhibiting the pain signaling and hyperpolarizing the neurons, but also it has an anti-inflammatory effect because it inhibits also some GABA receptors inhibit the calcium channels, and we know that influx of calcium can generate the free radicals and release from the endoplasmic reticulum and the mitochondria and induce inflammation and induce microgliosis, right? That's how the glutamate receptors work, right? So it's opposing that. And so it has very strong neuroprotective effect. I think we're done for today. I think we're at 10 p.m. now. We can finish the whole slides, which is another 50 slides. We already finished 50, maybe.
Yeah, we're getting there. It is now 10 o'clock, but it's up to you guys what you want to do. Right. It's Dr. Clearfield's meeting. We just
yeah. I've got it's 7 o'clock our time on the Pacific, so it's not too bad for us if you wanted to stay longer.
Well, I don't want to be overloading you with all this information and get bored and then people leaving. We have 16 people in the beginning, we start 20.
Why don't we do some questions and answers? Make sure let's answer
so let's
some
have
questions.
some answering questions. Yes.
Yep. We've got, can oxytocin be used for brain injuries? And what is the best way to
have it in the other
oxytocin?
slides? We can use it for traumatic brain injury, and I have slides for that because if it's anti-inflammatory, antioxidants, and it stimulates the GABA, it inhibits the nociceptive pathway, because oxytocin is part of the descending analgesic pathway, and it definitely inhibits this pain, vicious circle and the pain neuroplasticity of the amygdala, and at the spinal cord level, those vicious circle of pain signaling that's connected to the sympathetic, and that led to all this post-traumatic syndrome and all this traumatic brain injury mechanism. Yes, I think it's a good thing for both and for complex regional pain syndrome, and all of that is in the coming slides. So when we maybe come next time, I'm going to talk about how it's working in traumatic brain injury and post-traumatic syndrome and complex pain syndrome as well.
Okay, and then
and drug addiction as well.
Right. What is the best way to measure oxytocin?
Did you hear that, doctor? She said 24 hours of urinary collection to measure the oxytocin. They're treating it like cortisone.
Right.
So I think that the best perfect way there is some saliva testing of oxytocin. Is that reliable? Not as reliable as 24-hour collection of the urine. And I think using chromatography, you can detect those small quantities of oxytocin. We can treat the same way that we're using treating the drug abuse and all those narcotics in the urine. I think it's the best way, but it has to be 24 hours collection because of the production of oxytocin in our body. It's up and down. And if you're going to give exogenous oxytocin, I think the 24-hour urine collection will be the optimal way of measuring it.
And another question is, can oxytocin be used for low IgM level?
It does enhance the immune system in general, including IgM, IgG, IgA. It does increase the bone marrow release, so it increase the white blood cells count, and it I think it stimulates the thymus to secrete all this lymphopoietins or thymosins, peptides. So yes, I think it's an immune enhancer against the pathogens, but it gives you that tolerance as well against your own self-antigen by stimulating the PD-L1 and Tregs. So yes, the answer is yes.
IgM, it does not increase IgM.
In a physiological, I'm talking about physiological level, not the
Yeah,
pathological
no
level.
need to measure in the serum.
Right. So we need the IgM to protect us against the bacterial infection, right? And that's what
Yes.
I'm talking about. I'm not talking about any excessive pathological level. In general, it enhanced. This is what the article. It enhanced the immune system in general, but at the physiological level, not the pathological, not the excessive, imbalanced immune enhancement.
Okay, and then Doc wanted me to announce that next week is Dr. David Leskowitz, ONM and addiction. And then he also wanted to wish everyone a happy Thanksgiving.
Okay, great, beautiful.
Thank you.
Can I add
Wonderful.
something? This is Marie Fogarty. I am a patient advocate. I'm also a member of a Parkinson's support group, and not as a patient, but as a caregiver. And I don't know quite how. I feel so bad because I don't know how to talk to the people in the group, that most of them are old, decrepit, and suffering, and they've been sold, you know, so much the medicines, and oh, what's the new medicine coming down the pipe, and it's all really toxic, awful stuff. And I feel so bad for these people. So how can we get this information to them without making them feel like I'm a medicine man selling, you know, weird stuff? Does that make sense?
Well, I don't know if they can. Do you think our setting here that the patients can benefit, because we're using a lot of medical terminology, right?
If I can get them to do it, I'm thinking the one who's leading the group now is a patient, and she's in really bad shape because she has many medical problems besides the but she has a super brain. And if I could get her to watch the video, you know, watch this, I think she might be more open. But I thought maybe there was some way to condense some information into something I could hand out, or just to introduce them to the concept for their purposes.
What works sometimes in those cases, ma'am, is a test patient or two, a patient advocate or two, you know, someone who's been able to try it and can speak to what it did for them. Sometimes that can help that situation in a group, you know.
Do they have somebody who'd be willing to speak to them to do, you know?
Well, this is the mechanism how it works, right? You get the doctors here, they get interested and excited, and then those doctors, they will reach out to Dr. Mike Beamer, because he's the pharmacist who has the hub and data and material. He has also material and all that stuff. And then he will give all this material to that doctor or the patients will be connected to the Dr. Mike Beamer. And Dr. Mike Beamer has that good public breaking down the information for the patients, and he has time for that because that's his job, right? He's the one who is giving the medications and telling them with instructions, all that stuff, based on what the doctor is recommending. But he can add more to it based on the pharmaceutical and pharmacodynamic and all the good stuff. So he can add the material for those patients, and his relationship with his patients are great. So if you can connect Mike Beamer to do all this material along with the patient advocate, it's a triangle of relationship between a patient, doctor, and possibly you know, advocate like yourself to move things in a good way.
Okay.
And this is also a suggestion, Maria, since it's part of my profession too. Usually there's a on-duty nurse or someone that you can connect with that understands a little bit of this stuff and is more on our side. And I think that'd be a great way to ease this into Beamer.
Yeah, absolutely. I'm willing to help however I can.
We are open for patients to come here and listen, all that stuff. No problem for that for us. But I don't know if this information is too heavy for them and they get a little bit frustrated because of all this too much of medical terminology, and maybe they need somebody to break it down. But I don't know if this time did I break it down to make it easy. I use a lot of medical terminology, but at the same time I'm trying to relate to the public or to just the general understanding.
I think it's pretty decent.
if you want more Parkinson's to participate, I think if you had the first part where you explained, all about oxytocin and how it works and how many things it does besides just what you might be aiming for, and then combine the Parkinson's. If we had one small, condensed lecture like that, it would be easier to get them started.
Yeah,
Mike
I would talk
Beamer
about
is
how
your man. He is very good. He speaks the native language of English that I don't speak, and he can, with his southern accent and all that stuff. You need all those kind of, language skills and communication and using whatever the American culture are using to simplify things and make things easy for them. Which I lack that because I grow up outside overseas and also here. I'm born here in the state. But I don't feel myself I'm relating to the public like Mike Beamer does.
Right.
But I have a quick comment. I know it's late, but look, I understand your situation. Not you, Dr. Halasa. I cannot see the name, Maria. This is something, especially when I first got into anti-aging medicine. I wanted to go tell everybody. If I could just get them to see it.
I try to keep my big mouth shut sometimes because I'm afraid I'll scare them off.
Well, yeah, and that's what I did. Then I found out after I had all of these tools to help people that, most people either didn't believe me. There's so much, so many levels of development that, we've gone through, most of us recovering regular doctors to get to this point. And then with the FDA, the rules and regulations, you cannot advertise. If you create pamphlets, then it's a paper trail. So eventually I got to the point where the only way it worked is that people eventually sought me, and I basically retired myself from trying to convince people. It's unfortunate that this is the way it is, that people are misinformed, and and the truth, it reveals itself through the literature for people like us to translate. But just like we were indoctrinated in a certain way of understanding things, the general population is indoctrinated. And they have to be at the point, unfortunately, where they have opened up their mind to the point where they're looking for other solutions, and we can't go around convincing people that's just this is
exactly where
right.
Yeah,
exactly.
Right.
So I understand your pain. That's what I'm trying to say.
It's very frustrating, and it's so frustrating to hear these things and know that so many people can be helped, but our hands are tied because what you said. So there we are. But I think I will maybe try to get the one I was telling you about to watch this, and even our discussion at the end here that we're doing right now could help her see our pain and our viewpoint. And the fact that we just want to help, and maybe she would be more open to figuring out how we can do that.
Well, another thing to think about it is that it's not really a pharmaceutical drug; it's a bodily hormone,
Exactly.
and we're not giving a drug; we're giving a natural bodily hormone to replete a potential deficiency or malfunction of the systems that it operates within. So it's just like maybe saying to somebody, get your thyroid supplement, or get your testosterone or sex hormones balance. It's more in that world than it is like a pharmaceutical intervention. And it is an FDA approved drug, and it's also a bodily hormone, so it's quite safe in that regard. So there are some positives that would translate to the public more easily than maybe some other things.
Right.
Yeah, so it's a love hormone. It's the power of love. You tell them you're gonna be healed by power of love. And
that won't go away. They'll for sure think you're selling snake oil.
But that's the reality. I mean, basically, I hear a lot of events that people, they go to the church and they heal, or went to the mosque, or went to the
They don't believe you can put it in
Holy
the bottle.
Lands, and
No.
they heal. And part of it could be because of the excitement that the oxytocin kicks up and give them that euphoria, and that the serotonin and dopamine and those happy molecules and endorphins. Even as I said before, the mushroom and ecstasy, if you go and you look at the mechanism, it's mediated by oxytocin. Oxytocin goes up. And so this social gathering, the way that we feel about it, and we feel happy, and that's why we attend to those social gathering, it makes us excited and happy. At the same time, it gives that healing part, that healing function as well, because oxytocin is anti-inflammatory and antioxidant, and it does have anti-cancer. We're going to talk about it in the coming slides as well. So we need to really give some credibility for all those stories about people are going to the church and they feel better, or they hear the voice of the scriptures and they read the Bible and they feel great. And we talked about reading in the first slides, especially the information that gives you hope, that entertain you, that excites you, that takes the depression out. It definitely increases oxytocin. And it's not a placebo anymore, because before, even in a pharmaceutical setting, we divide the people with placebo versus giving treatment. But we need to consider that part of oxytocin in the placebo as well. Because if you tell the patient, hey, this drug is going to help you, because even if you give them normal saline and you tell them there's medicine in it, is going to help you and all that stuff, just because of the expectation this is going to help, it may increase the oxytocin, and it does give you physical treatment. So those are things that we need to consider it when we're doing clinical trials, and it's something we need to think about it. Why people who are in love and people who are having good relationship with their spouse and having sex and all that stuff, they look younger, they look healthier, their blood pressure drops, their insulin is good, their sugar is good. Why versus the person who is being divorced and having bad relationship, lonely, they get sick and they age fast and they look, like the dermatologist. I mean, she spoke in the video there, and that the explanation is there, is that oxytocin is high in those patients who are happy and excited and satisfied, versus the people who are lonely and with no love, with no passion, with no massage, with no sex, with no skin stroking, and all that stuff. So this kind of things we need to consider a serious thing. It's not anymore placebo. I know Dr. Fauci and the mainstream medicine may consider this as a snake oil, but it's not snake oil anymore, because now we have chemistry, and that chemistry mechanism of action will make those mainstream men on the board with us. It makes sense?
Excellent. Yes, it does.
Hey, I put my number, my email, and my phone number in the chat for you if you need it. I'm gonna have to split, guys. It's getting late for me where I'm at, but thank you for everything, and I'll catch y'all next time.
All right. Thank you, everybody, and good night. And
Thank you, everybody. Have a happy
we'll finish the
Thanksgiving.
slides when we have time. I mean, when we schedule another one, we can finish all the slides.
Sounds like a plan. Thank you very much
Bye.
for the
Take care.
presentation, Dr.
Bye.
Halasa. Bye, everybody. Happy Thanksgiving.
Bye.
Now I got it in this. Hey, bud. Hoorah. Great class. Great class.
Happy Thanksgiving.
You know it. Did we already lose Maria?
No, I'm
Doggone.
still here.
Oh, good. Good luck. Good luck with what you're doing.
I will need it. We have our Christmas meeting on the 1st, so
Nice.
I'll talk to Mike Beamer.
Yeah. Yep. Mike Beamer.
I will talk to him and see what he suggests and go from there.
The O, I think, is silent. It's kind of interesting.
Yeah, I introduced some the charcoal thing last time to her, and she seemed open, but it's really hard when you're fighting so many aspects of your health to let anything else come into your brain, because you're already so stressed. She's really stressed, and she's heading the whole group now because we've lost so many people to COVID and what have you.
Yeah.
So
Wow.
anyway, we keep trying.
Saying a prayer for you for sure.
Thank you. We need all the prayers we can get.
Oh man, and it's only going to get worse. Hate to say that.
No, I know it is, because you know, the stress of turning on the TV and listening to anything is will get to you. So,
What
it's-
TV? I don't even own one.
oh,
I
my
stopped.
phone is entertained, but
I couldn't do
yeah,
it.
you can either listen to it and weep, or you can listen to it and learn and try to think of ways to ameliorate the pain and suffering. And that's what I'm
Amen.
trying to do.
And I didn't ask you, John. Doc usually finishes off the, is there anything you have to say?
No, man, but it's interesting. I have you and Marie on this talk at the same time. Marie and I work together several times a week, and we do it in depth. We do this Tahoe Tuesday with you dudes on Tuesday. Marie and I have a separate meeting we put together every Saturday at 1 p.m. where
Okay,
we review these topics and ask the same question every week. What good can we do? It's interesting, and the reason I'm talking to, because we have you both on, we also still have a television studio here, and Marie's involved with that. She's been helping me clean that up. Plus, she has a healing center where she does her thing. So she's very, very much involved and extremely dedicated for at least 40 years I know of. And so anyway, if we're trying to distribute information and help this group, we do have a television studio we're putting together. And we've had that working before. You just got to clean it out and turn it on. But that might be an option that we can all work on later to spread the information, to spread the word and do some good. We just have to be discreet, because not everybody wants to hear what we have to say.
Exactly.
I'm into that. I'd love an invite to that meeting. I'd love to be part of that.
Well, I sent an email to Marie today, and I said, we got to speak to Joel. We got to get this
Well, I've
going.
been saying that for a month or months now.
So we're thinking of you, Joel and Bill and everybody else in
Amen.
this group. We're trying to do some good, and everyone's
Now,
appreciated.
it's a, you know, kind of a local meeting, but it would be good to have a kind of a video thing going, unless you want to come out here.
I like road trips. Yeah, I could use a road trip. I'll be honest.
Let's be honest with this. I think there are a couple of people that need a break. Joel, you've been with us for years and years. If we can work it out, so you come out here and check out our scene. And we also have a VA center, and we have a pretty good reputation around here ourselves and a couple of other nice guys. We can get your ass out here.
Right.
You see what we're doing. I think we should work toward that.
Agree. I would love it. You know
We'll
that.
do it.
Sounds like a plan.
We got
Anybody
it.
else have anything to add or say? Nope. Cool. All right.
Thanks again.
You
Joel,
bet.
this is Sylvia. Just wanted to say happy Thanksgiving to you.
I was hoping you'd speak up. Yay. That made my Thanksgiving. Thank you. You too.
Okay.
She
Be
sends
good.
her good vibes every time she speaks.
I know, right?
Yeah,
That's how we should end every Zoom.
yeah, definitely.
Have fun with the turkey or your vegetarian.
You betcha. All right,
Turkey.
guys.
Okay. Bye-bye.
Have a wonderful Thanksgiving.
Thank you. Bye.